about substance abuse. The main use of substance abuse by the mental health industry is to deny the mentally ill are no more violent. Whenever anyone comes up and talks about the mentally ill being more violent than others, I say, well, if you X out substance abuse, then you don't have increased rates of violence. But what you're doing by doing that is basically excluding roughly 40% of the population. And they are ones who are likely to be violent. It's like if you did a study of how well the elderly walk, and you eliminated everyone who used a walker or a cane. Then you could say the elderly walk as well as everyone else. Substance abuse is a very real issue, and also the other issue I don't talk about is youth, which Michael talks about more, because I followed my own advice and I've gone deep on what I know. Substance abuse is a whole other issue. I'll tell you, there are people, Dr. Sally Sattel at the American Enterprise Institute, also a professor at Yale, and also I can say with my own experience, people can quit drugs. Yet we've accepted the fact that they can't. And I quit, you know? So the question is it really a medical issue? Well, we've come to accept that it is, and I'm not arguing it is or it isn't. I'm saying I haven't studied the issue. I think that the fact that some people quit on their own suggests that maybe there is will involved, and it's not strictly a medical issue. But substance abusers are probably duly diagnosed, are probably shunned even more than the 4% I talk about if they have that dual diagnosis.
And the second part about the funding, say NHSA funding going to more community-minded, oriented kind of things versus.
Well, I got
I'm
some.
looking for more philosophical, like you sort of said that's not necessarily productive. I'm saying it might be productive, and that's around.
Again, I think the majority, especially of the prevention and early intervention funds, the community funds, are going to teach the public that the mentally ill are not more violent, that they don't need help, that they don't suffer, that everyone recovers. I think they're being used counterproductively in the community, not productively. The programs are good. Many of the programs are good, and I don't mean it as a vote, but largely the prevention and early intervention funds are not going to help the most seriously ill, and they're going to programs that I think are harmful.
Thank you.
Yeah, I don't disagree. And so I know there's not. DJ said, okay, where's the evidence to say that working with a peer in mental health as opposed to a peer in substance use, because it's well founded in substance use, because the experience of that individual, is it founded in research in mental health and peer support? Support, yes. Somebody who understands and can relate to the person, yes. Is that a peer? Yes, it is. But does it have to be a peer? Well, we don't have evidence to say that. So I did have to agree with you on that. I'm not saying it, but we are trying to get that evidence.
So if you're talking about peer support, as Michael said, peer support clearly helps veterans, clearly helps prisoners, clearly helps substance abusers. There is no evidence peer support helps.
Yeah, okay, but if you have a serious mental illness and I don't know how to talk to you, how are you going to get my help? Right? I mean, a lot of people are put off by people.
No, the issue isn't the issue. Paying attention to somebody, which a peer supporter does, is clearly good. Taking someone bowling. If I have a criticism of some of the stuff I say, it's that I diss these programs like Family Activity Night and Homework Clubs. Activity in and of itself helps the seriously ill. The question is, does that help have to be provided by a peer? Do peers have a special sauce that makes them better able to help someone than someone else?
I would say that they don't have the sauce that unfortunately comes with stigma. It's the stigma sauce, we call it. You buy at the local store, you're not looking at can, but that exists. So if I pour some stigma sauce on me and then I'm taking you bowling, it doesn't really feel like it's your kid. You know, it's this person taking you bowling who's paid to do it. Oh my God, how much money I spend with this guy? Versus somebody who's been there, man, who fights this. I think there's intuitively, even though the evidence isn't there, I think intuitively there's some support for it. It was an interesting drive over the hill. I don't know how I kept in the car when I talked to this
And
guy.
let's say in my own case, I pay some gay real estate guy who I found on Craigslist to go and take my mentally ill sister-in-law out. He's not a peer. He goes and takes her bowling or takes her out. And I don't think there's any evidence that peer would be better. And in fact, she likes not dealing with other people who have mental illness. So that, you know, now I do believe being a peer supporter is benefit. I think that getting a paycheck, feeling you're helping other people, and in fact helping other people is good. My biggest beef with peer support, because I don't think it does harm generally, is that the organizations that get the money are largely anti-psychiatry. So the individuals giving out peer support are fine. But in many counties in California, they've had Laura's Law hearings, found them stuffed with peers wearing matching t-shirts against Laura's Law, paid for by Mental Health Services Act. So the peers are being turned into anti-treatment advocates by the peers. I say they've kind of become a jobs program.
All right, so let's move on to a question here, and then we'll
I
go.
recently have started working as a case manager, and my experience with my peers in my position who don't identify as having mental illness is that there's a huge lack of compassion, a lack of respect. They don't have the same perspective when they're dealing with their clients as they do if you go to the second story of your respite house here in Santa Cruz County and you walk in there and everyone in there is a peer. The employees, the guests, the volunteers, and there's just such an atmosphere of compassion and understanding and acceptance, which is going to go a huge way to making you in a better place to heal.
Yeah, I know where you're going to go with that answer. So,
I agree about the compassion part. I don't think that because I'm not a peer, I can't be compassionate. But there's zero evidence for that second piece, that it improves outcomes.
Because no one's bothered to look into it.
No, it has been studied. That's the issue. It has been studied. The peer movement will only study, there's two major collections of studies on peer support. One's by the National Empowerment Center in Massachusetts, one's by the Substance Abuse, and they each list about 50 studies. None of them.
so the fault that I have, second from a different angle, and that who's a peer, seriously mentally ill people, the people called peer counselors are not necessarily, they have a mental health condition, yes. Are they seriously mentally ill, significant schizophrenic symptoms? That's not always the case. So that's just a definition of peer. I mean, I think, you know, it's a long discussion, but I think it's very complex.
That's
But
true,
I-
but I think if
yeah.
you step out of the box and you're willing to identify as a peer, then you're willing to have that compassion and look at people as a human.
That part, I think
We agree.
Yeah, we
So
agree.
do other people.
Let's move on.
So I just, looking at the graphic about, that says we need more hospitals and compares from 1960 to 2014, people hospitalized and incarcerated. Just to contextualize that, during that period, there was a huge explosion in the number of people incarcerated in this country, over 7 times. So as far as the percentage of those that are made up of mentally ill, it's perfectly in line. As far as overall, the number of people that are locked up between that time and 2014, that's actually gone down. So
No.
if you
No, and that data, maybe I don't have the footnotes there, that is not total incarceration, that's total incarceration of the mentally ill.
Yeah.
right,
The data
that's,
in there.
that's
While jail populations have come down recently, the percentage of those in jail with mental illness is going up.
It continues to rise, but your point's good. And
But
it's because we have an overall incarceration issue,
But
not
if
just
you,
with
if
people.
you look at the total numbers between 1960 and 2014 in that graphic, and you add up the total number of people that are incarcerated plus hospitalized, in 1960 when the population was actually lower, you had 590,000, and currently now when the population is actually
Yeah, so it's per capita, it should be per capita.
Homelessness accounts for the difference, but you're right, I didn't adjust it for population, I didn't know how to do the
Oh,
math.
see, I got better slides. I don't have a book, but I got better slides on that one.
I just think that it's important to contextualize these numbers in
Yes.
the context of that overall we have an explosion in incarceration, and that even so, the number of people that are locked up is not,
Yeah,
you know, gone through roof at the same amount that it has in overall nationwide, as far as 7 times. It's not 7 times higher now than it was.
and I agree to that point, so, you have another point?
Yeah, so I just wanted to ask about, the statistics about Laura's Law and to contextualize those. As far as the situation, it seems like a lot of the issues that occur are more likely to occur to homeless individuals, and that just simply providing housing would reduce incarceration, reduce emergency contacts, reduce hospitalizations. Is there information that just identifies
Yes.
what the impact of
Yes,
providing
because
housing
the
is?
reality, Laura's Law is only available for people who will refuse that voluntarily. So yes, for somebody who has mental illness, giving them housing will also reduce those rates. But Laura's Law people won't accept that housing or that treatment. That's why they need the court order. So yes, housing is an effective treatment for those who accept it. Medicines are an effective treatment for those who accept it. Those people are ineligible for Laura's Law. Among those eligible, though, they would refuse those. So this is a way to see that they get the community services. So your point is kind of right, but they're two different populations.
Yeah, so I'm gonna agree with him on this point, because I read Laura's Law thinking it was coercion, right? Because that's what I hear, it's coercion. You have to take this pill, or you're gonna get locked up. To me, as a provider of services at hospital levels and outpatient services, I really don't like that, because it puts us against people, right? And now it makes us the enemy, because we have services, and that's not, I don't believe in coercing, I believe in talking to people, make a co-production model. That's how mental health treatment works. The patient's not an active participant in their care, and their goals aren't central, you're losing it, right? They may get better because you do whatever and they just get some sleep, but they're not gonna get better, and there's some ideas have one hospitalization and that's it, that's the goal, and have them get the treatment they need, but their goals have to be central. So that, to your point, absolutely. The thing about Laura's Law, when I read it though, was that it wasn't really so much that. What I read it was, this sounds like a patient advocacy. This sounds like it was written by patient advocate group. Because the onus isn't so much on the patient. You can't put the patient in the hospital because they didn't take the pill. What you can do is you can have the evaluation for 5150. Well, that can happen anytime anyway, right? That's the only thing it really draws. They can't put them in jail because they missed, or in a psychiatric hospital because they missed an appointment or missed a pill or refused to. That does not give them the right to give a civil commitment. Laura's Law doesn't read that way. But if you read it, and now what does Laura's Law do? Laura's Law requires that the people who are, and it's usually the police will talk about the people, the family comes forward, and we look at the cost of service. The person is failing. They are failing out there. They're dying out there. And what it does is it forces the providers to provide housing, to provide case management service, provide whatever it takes to get that person to where they're not going to die on the streets. That's how I read it. I expected to read it as a coercion law. I read it that way, and I became a Laura Law supporter. And I think most places are now, more counties are seeing it.
Most people make a mistake about Laura's Law is they compare it to voluntary services. If somebody's eligible for voluntary services, housing works, treatment works, all those things work. But what about those who won't accept those treatments? For that small group, very small group, Laura's Law works.
But as far as improving outcomes overall for people in this community who have mental illness and who are homeless, the most essential need is housing. And so many of those people are trying to get housing, even have some support as far as vouchers, and they are not able to obtain housing.
Yeah, there's
And
yeah.
I think, I don't have the statistics at my fingertips, but I feel like as far as the costs in hospitalization, in arrests, in emergency contacts, if that housing were provided, that we would see a plummeting.
To the point,
You're
to
right.
the point, absolutely right.
You're
Yeah.
right. But that's a different group. This is a group who won't. If you took this group and gave them housing, the landlord's going to kick them out because they're going to get psychotic. They tried it to my sister-in-law. Her rooms could totally deteriorate.
I think we've seen at that point. I'm going to say, but your point is that this, we're not talking about Laura's Law people. We're talking about a lot of people who are homeless, who are looking for services and looking for housing and they can't get it, right?
Yeah, and whatever form that housing might take, if that's some kind of, involves some kind of support,
Right.
but we need to have more alternatives that fall short of hospitalization, that provide housing, that provide support.
Nodding
for
heads,
people.
absolutely.
Everyone's
Absolutely,
doing it.
yeah. Good point.
Maybe misunderstood you, but I thought you were saying that peers were not successful in our most successful programs,
Right,
as well as our Peer Connections group.
right.
And I can't tell you the number of people who have come to me and told me what a difference it made in their lives.
Right.
To have a peer and to have somebody who actually understands.
Right.
And they seem to support each other in a way that I can't.
Right.
I think it's tremendous.
First of all, there's no doubt that those who give peer support think it's a very successful program.
I absolutely.
There is no doubt that somebody receiving attention from somebody else likes it. The question I'm raising, do peer supporters have a special sauce that makes them better than others?
I
And
think
what
so,
metric?
They have some sauce that I don't have.
What metric are you using to say whether, but believe me, I'm not against peer support.
You say the evidence hasn't been
Yeah.
done yet.
The studies have been done and proven no benefit. Meaningful metrics, the metrics that have gone up are the ones you're probably seeing: sense of hopefulness, sense of empowerment, sense of accomplishment, sense of wellness.
Right.
Homelessness, hospitalization, arrest, suicide, incarceration are unchanged. And would they have changed if they had been given professional support? Huh?
That may be, but that's only one part of the problem. The
Okay.
person's living a better quality of life because of their peer support, and that's an important thing.
Okay.
Yeah, that's good.
And that's
This is a great debate, it absolutely is. It's a great debate, and this debate's going on in Washington around funding for this stuff.
First, I said I very much enjoyed your discussion. I enjoyed this banter back and forth. And I want to say that
his part.
no, it's fun. I agree with what I'm hearing on your arguments. I want to purchase your book. But with that said, a lot of times national policy issues is a pendulum, right? Things fall in one camp of thought, and then another camp it goes back 20 years. You know, if it falls out of favor, etc. And there's a level of political correctness, so some people, you know, shy away from saying things directly. But ultimately, there's a federal government, states, and counties. And the way I understand it, the counties are really the deliverer of mental health care, mental services. But each state has different laws. So I'm really looking at what discretion do counties have versus, you know, federal mandates, state mandates, versus, you know, how can they use best practices in other areas, et cetera.
California is unique because of the Mental Health Services Act. It's $1.5 billion, and you don't have federal regulations attached to that. So that's what's so disturbing about it. And the law was specifically supposed to help the seriously ill. Los Angeles County and Los Angeles City both just passed resolutions to do what you're talking about, they were voter initiatives to do bonding, to get more housing for the mentally ill. But there's also another bill in, matter of fact, is today Tuesday? Today there was a hearing in the California State Senate on the Mental Health Services Act. And what probably happened, obviously I'm not there, but what probably happened is all the people, when you get you're distributing $1.5 billion, you get a lot of people going to these meetings and saying,
I'll validate that as a provider of inpatient and outpatient services. I went to the MHSA big rollout meeting, and me to represent all of our services, and had brought their entire organizations and filled up tables just to be. I mean, it was like this was amazing. So it was a lobbying effort because that's a big funding source for these not-for-profit organizations, many of which provide fantastic work, but it's not going to the seriously mentally ill as it was intended. It's not. And for housing as is needed. It was going for services. The question is that really the target population where those funds should be going to? Should it go to the 0 to 5 year olds? Is that really where that money should be going? It's a question. You have many other issues.
So you said it's strictly on California, but so between Santa Clara County, Santa Cruz County, San Mateo County, what would you say percentage discretion those board of supervisors have on how they treat mental those?
well, the board they're really rubber stamping the behavioral health directors, and the behavioral health directors are rubber stamping the community planning boards. Again, it's important to understand the behavioral health directors in all the counties are looking at the mental health industry as their constituency. They have tremendous amount. Matter of fact, I would argue they are required to use the money for the seriously mentally ill. But we don't have lawyers, and we don't go to the meetings. We've got ill kids. We have jobs during the day. But the mental health industry, any executive director is going to give their deputy director the day day off to go to a Mental Health Services Act meeting where they're deciding where the funds are going. They're gonna be at that meeting.
So there is an accountability oversight committee, as you mentioned, right? And so I've got a meeting with that guy coming up like the next week or so, 33-minute phone call meeting to bridge that area for child mental health services and what that should look like with MHSA funding. But the best place to get sources, we wouldn't have time to get into it, is the Little Hoover Commission report, which is, and they admit it, slanted a bit in places, but they really called out a lot of the programs, which probably got information from gave tonight, on where the funding is going, where maybe it's not.
And they're on our website, the two Little Hoover Commission reports, the state auditor report, our report, the bait and switch report are all on the Mental Health Policy or California website.
Hi there. I want to answer your question because I cover the County Board of Supervisors. My name is John D. Gubbs, and I wrote a story about how the supervisors voted 4-1 to award $4.1 million to 44 different nonprofits, and there was some money allocated for a suicide prevention campaign. And the areas that they have a priority includes health, including mental health. There were a number of things, including the mental health community action network got some funding. Children and youth was another prime area. Senior citizens was an area, so they had 4 areas that they were prioritizing. Mental health was in the mix, and there were a lot of people attending from all the nonprofits. And I don't know if any folks here were at that meeting, but this was the big opportunity, and it was not rubber stamped by the mental health director. There was 3 dozen expert panelists from, who are familiar with these areas that reviewed proposals, not even knowing how much money they got. So it seemed to me like it was a blind test where they went in, they evaluated it, they looked at, is this research and
those general fund dollars, though,
so
right?
that's what was done here in Santa Cruz County.
But that was general fund. Correct, I just want to
That was
support,
in
and that's not MHSA funding, that's general fund dollars. So that's a different issue entirely. So that's,
It's
your
$4
point.
million, so.
That's
it's
not a rubber
something-
stamp. That funding doesn't come from the Behavioral Health Care Association. It's a completely different issue. I'm sorry, but it's a completely different issue.
In the last couple months, I've watched my son's locked up in Santa Cruz County Jail in 23-hour solitary confinement. He's mentally ill. I can't get him out. He's been there since October 8th. He was arrested. I took him to a motel because he doesn't have housing, and he alienated the family and my stepdaughter and couldn't stay with us. So he was arrested for touching and messing with the housekeeper, put in jail. They tried, over the last 6 months, he's been released 3 times, one to the most intensive outpatient program Santa Cruz County has in most programs, and then to El Dorado House, the 3-month halfway house, twice, and then to Casa Pacifica in Watsonville, the dual diagnosed house, where people stay 6 to 12 months. He burned through all those programs very quickly, not with any criminal behavior, but with his mental health symptomology. So he goes back to jail every time. I've been, there's district attorney reps, public defenders, mental health people, head of adult mental health, nonprofit people, tons of people wringing their hands. What should we do? Because, one, they have no housing to set this person up in. That would be supported by housing. I don't mean an independent home. I mean a supervised transition center that can take somebody to a hospital, take somebody to a rubber room if they need it, and then bring them back when they're ready. So they have no, there's that. And the other thing, Santa Cruz County Mental Health puts all their money into wellness programs. I sit in the reception area where my son doesn't show up for his appointment. I'm watching people come and go. They know the receptionist names, high five, their social worker, fantastic rapport. They know their illness. They've been, through time, God bless them and the system, been able to get themselves to this plateau where they're functional in their illness, right? But the people that are suffering the most, that have serious mental illness, that in high levels of agitation, occasional bouts of aggression, a sense of defiance. And you're talking about it, my son's 30 years old, and there are tons of females, and I might say a higher percentage of males that have this profile that will not be treated in the mental health system. They will not be kept by halfway house, a group home, even a hospital. And they are put in the pits of the jails. And that's basically where he's relegated to. There's a plan to pull him out now, but the county is so tight-fisted, and this is a disincentive. The county will spend all kinds of money on outpatient resource services because it's a revenue stream for them. They bill the federal government and the state Medi-Cal, and they get paid. All those people sitting at Emmeline that are doing services for people that are actually doing really well and probably don't need the services much, that's dollars for the county. When they send someone to a placement, to a hospital, to a IMD, to a center for real treatment, county has to pay someone for that. It's not part of the revenue stream. So they're super tight-fisted. They have total fiscal bias against the severely mentally ill.
But, Michael couldn't talk to me about funding, but what advocates have to understand is no government official cares about saving money. They really don't. What they care about is saving money on their budget.
Right.
So the federal government wants to save federal money, the governor's money, the county money, and it goes even worse than that. The behavioral health director wants to save his department money or her department money,